Good morning, everybody. I am Sanya, your host from today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic that is psoriasis. Psoriasis, a condition in which skin cells build up and from scales and itchy dry patches. Psoriasis is thought to be an immune system problem. Triggers include infection, stress, and cold. Today, the most common symptoms of psoriasis is a rash on the skin, but sometimes the rash involves the nails or joints as well. It can start at any age, but most often develops in adults between 20 and 30 years old and between 50 and 60 years old. It affects men and women equally. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how it can be prevented, the kind of test required for its diagnosis, and the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us today renowned dermatologist of India, Dr. Anupama M. She is an MBBS, MD dermatology, venereology, and leprosy, DNB pediatric dermatologist. Dr. Anupama M P is a dermatologist and pediatric dermatologist in Jayanagar 4 Field Block, Bangalore, and has experience of 14 years in this field. Dr. Anupama MP practices as Dr. Anupama Skin World in Jayanagar 4 Block, Bangalore. She completed MBBS from KVJ Medical College, Solaya in 2008 and MD Dermatology, Venereology and Leprosy from Madras Medical College, Chennai in 2013 and DNB Dermatology, Venereology and Leprosy from National Board of Examination, India in 2016. A very warm welcome to you, Dr. Anupama MP, and it's a pleasure to have you with us. And today we are going to discuss a very important topic that is psoriasis.
Thank you. I am happy to be here discussing about the topic psoriasis.
And doctor, as we are going to discuss about psoriasis, what is psoriasis? How we can define it?
So, psoriasis is a common chronic immune-mediated disorder, skin disorder. Mostly it is papillosquamous. We call it as a papillosquamous disorder. Okay. So it can occur in any age, as you mentioned. It can occur in children or in adults. Okay. Then in adults, it is bimodal. It means it occurs in two age peaks. One is in the fourth decade, that is, another is the 50th or 70th decade. Okay. Then, yeah.
Okay, and what are the symptoms if someone, have the early psoriasis or what are the early symptoms of it? How someone can, clearly define that, I am having such kind of problem and I should go to a dermatologist.
So people, when they come to know they have psoriasis, initially they present with erythematous, red color skin patches, we call it as a thick. It's just not a rash, it's a thick flocks. They present mostly commonly on the extensive surface of their body, just like the extensive surface of the upper arm, elbows, knees, legs. And some people, it can also affect the scalp, nails, all this. So it depends on what type of psoriasis. We do have different types of psoriasis. One is most common one is chronic plaque psoriasis, which presents in the extensive surface. And people, we have a incidence of scalp psoriasis only. Only the patient comes with like a dandruff, but they'll have a very thick plaques on the scalp, all over the scalp. Okay, these are all the most common presentation is only thick plaques on the skin surface.
Okay, and doctor, what are the causes? What are the main causes of it?
Okay. Psoriasis, as we mentioned, it is an hereditary. It can be genetically mediated disorders. That, like for example, if your parents are psoriatic, your chance of getting of psoriasis is very high. Okay, and in case of monozygotic twins and zygotic twins, the chances are much more evident. Okay, so it can be mostly hereditary. 40% of our psoriatic patients they have a hereditary disorder history also. Okay, and but it can also occur in sporadic cases, just like that. We can start with you only, right? It can happen like that. So most of the exaggerated factors are there for psoriasis. Your lifestyle changes, obesity, your comorbidities like diabetes, hypertension, all this can add on to this. And some people who are on medications, some like oral anti-malarials, then oral antipsychotic drug and oral painkillers, all this patient can also have a precipitation of psoriasis, and also exaggeration of the psoriasis can happen in these kind of patients.
Okay, so that means there are different causes in different people.
Mostly
Okay.
hereditary, 40%.
Okay. And doctor, is it contagious? If somebody is having psoriasis, and people usually what they do that this is a big problem and we should not, around that person. So is it contagious?
See, this is very good topic to raise. Is it contagious? Because psoriasis itself is associated with lot of social stigma, social withdrawal, hmm, and mental disorders also, because it's a chronic disorder. One thing you should keep in mind: psoriasis is not contagious. It is not an infectious disease, right? It's just an inflammatory disease where, because you're prone for it, you're genetically prone for it, hereditarily prone for it, and your lifestyle and your genes are making it prone for you. It's not that it is caused by any other infections, right? Some infection can trigger it, like fever, stress, and sore throat. All this can trigger your inflammatory reaction, but as such, psoriasis is itself is not contagious.
Okay, so that means that if somebody is having it, people need not to worry about that. Is it also like that, that if somebody is having psoriasis, then the people should not use their used clothes or their body wash or something like that?
As I told you, it's not contagious. It's not going to spread through the fomites, right? Fomites, like what can be your towel, clothes, using the same bed sheet, all those things. It's not going to spread you anything.
Okay, so you need not to worry if somebody is having it. You just accept it that it is not contagious. It cannot spread from one person to another.
Contact.
Uh, Right, doctor. There might be a lot of people who use over-the-counter products or over-the-counter
Yes.
medicines, or suggested, by their friends or family that my friend has this, and he or she used this medicine and it is gone. So, what is your advice to the people who don't go to a dermatologist? In spite of that, they self-medicate.
Okay. So, over the counter medication, most of the time they are filled with steroids. Okay. One of the treatment option dermatologists use for the psoriasis is also steroids. But what will happen, the over the counter medication, they don't know the concentration of steroid, and most of them come in multiple combinations with antifungal, antibacterial, all those things, which is not helpful, and it can cause further skin damage. So, better to consult your dermatologist to have the right combination of the drugs and right amount of drug and right concentration of the drug, and how frequently you have to apply and how long you have to apply. So otherwise you will end up with skin thickening. Steroid itself has a lot of side effects like skin thinning, depigmentation, all this can happen. So better to have a consult consult your dermatologist for better proper usage of medication.
Okay, so that means do not self-medicate. It is not advisable.
Yes.
Okay. And doctor, what are the triggers of it? Are there any triggers or any dietary precautions one should take?
So psoriasis itself has a lot of triggering factors. You starting with your stress. Okay, stress itself can trigger a lot of inflammatory mediators in our body and initiate the psoriasis. And psoriasis is an inflammatory disease. Any inflammation can cause trigger this, and also lifestyles like alcoholics, it gonna trigger smoking habits, it gonna trigger. Then you and the dietary changes like increase intake of all kind of oily foods, high glycemic index, which can all the inflammation, or it can cause diabetes itself, and diabetes itself can be associated with psoriasis. Okay. And yeah, some foods can also helpful for psoriasis, like it can improve the psoriatic lesions like omega fatty acid. All this can be taken by the patient, which is going to help you. Okay. As such, the triggering factors are the stress, smoking, infections, and pregnancies. In pregnancies, many flares up you can see, and in case of infections like throat infection, normal fever, normal viral flus can also trigger your psoriasis.
Okay, so these are the triggers if somebody is having it. So these can be worsened if they are not if they are not like applying all this and they are using they are smoking or they are drinking or as you suggested. So it can be worsened.
Come again, please.
So if somebody is not having a good lifestyle, or we can say they are still
Yes.
smoking and ignoring all
Yeah.
this.
Yeah, smoking or alcoholic, obesity, all these are the triggering factors. These people, this kind of patients tend to have chronic disorders. Like and it recurrence is common, and it is very difficult for them to treat. And these people can have a metabolic syndrome as such. Obesity can associate with metabolic syndrome, your diabetes, hypertension, and also this patient can also be further complicate with involvement of cardiovascular system also. Hmm. So better to
Okay.
change your lifestyle modification for good exercise, and quitting smoking and alcohol going to help in a long way.
Okay, so that means a good lifestyle will definitely help rather than not doing all the things and just ignoring psoriasis that it will go. Is it like that if somebody do not take proper treatment and sometimes people do that now it's not visible or now I am not having any kind of pain or rash, so I should not eat medicines.
Yeah, it can happen in few patients because psoriasis is as a seasonal variation also. Some people tend to improve very well in the summer. Some people have precipitating of psoriatic lesion in this winter season. So they use it the over-the-counter medication on the winter season and tend to ignore it on the summer side. So that is in the milder case. Once there is a strong, like severe cases, like all over the body involvement, these people and tend to get fall into the chronic plaque. Mild can go into the severe, and it can go into erythroderma, what we call it. Erythroderma means involvement of the whole 90% of body, where the erythema staining can spread all over the body. That it becomes a dermatological emergency also. We need to admit the patient, evaluate the status of the patient, vitals, fluid management, protein management, because they tend to lose lot of protein in the skins and scales because of this. So you need not, and patient who uses ayurvedic medicine or any other applications, external application, they also tend to precipitate and go into the erythroderma phase, which is dermatological emergencies. We need to treat the patient. So ignoring is something we should not never do in a psoriasis.
Okay. And doctor, sometimes people also use home remedies. So is it good to use home remedies, applying something, what we call it, nuske of home that, apply
So
haldi,
home
turmeric, or
medicine
any
itself,
sort of thing?
yeah, home medicine itself cannot help in psoriasis. It only exaggerate and irritate the skin and complicate the skin with secondary infections. Okay, they said because barrier system is not, the skin barrier is already damaged. If you're doing applying something and not helping you much, and it causes lot of route of entry for the bacteria. So better not to use the home remedies in case of psoriasis, especially.
Okay. So not advisable that one should use home remedies.
Yes, true.
And doctor, we have talked about the causes, the symptoms, what is the psoriasis. What are the treatment options which are available for it?
So, depending on the body surface area, if it is less than 10 to 20%, we only going to manage the patient with topical agents. So, what are the topical agents available for psoriasis? If you ask me, it is most of the time we use a topical steroid in a right amount, in right amount of duration, and also vitamin D analogs is the most used, and cold tap preparation. All these are available medications. Before that, we're going to repair the barrier system. So, lot of emollients, moisturizers is very important in the treatment of psoriasis. First, we'll ask the patient to apply the emollients, then the steroid in a involvement area. So these are the topical measures. Is the involvement is more than 20% of body area, and there is a complicated, like it mean associated with arthritis or all those things, we need to interfere with medications, oral medication. The oral medications will be started after the detailed investigation of the patient. Like all the systems should be in the normal, no infections like tuberculosis, which is common in our Indian setup. We have to rule out the infectious diseases before starting on immunosuppressant. What are the immunosuppressant available? We have methotrexate, which is commonly used here and well studied in psoriasis with very good results. Okay. Then we have a cyclosporine, apremilast, then on another group are called retinoids, acetretin, which is an indication of pustular psoriasis. These are the medicines. And in case the patient who are recalcitrant to this normal immunosuppressant we are using, we also treat with them with biologicals. So what are the biologicals available? We have infliximab, adalimumab, seplumumab. All these are the biologicals we interfere when the conventional treatment is not happening, not working in a patient. Okay. And
Okay.
also the
So
other set of treatment is older patients where we know we cannot give the oral medication because of their age. We also do phototherapy. And younger in children and in pregnancy, we can do phototherapy. Phototherapy is a light therapy. We use the UVB ray in a controlled manner. In a phototherapy unit, we use this. Okay.
okay, so that means there are treatment options available. It is not like that it cannot be treated.
Yes, it is controllable, well controllable, just like your diabetes. It can be controlled completely, and there will be disease-free period will be longer time if you are in a right treatment.
Right. So treating it right is important, and as you told, it is controllable. And is it like that the people who are older and younger, there are any sort of treatment difference? As you have already mentioned that in older
Yes,
people,
yes.
you do not give.
Older patient, extensive involvement, we cannot give them immunosuppressant much because it involves immunosuppressant generally weakens your immunity, right? And it can make you susceptible to infections, all those. So in older patient, we have safer option. Topical treatments can be used, and along with phototherapy is the best treatment for them. Hmm. Even younger kids who are less than that, so childhood psoriasis is also common, not very common as adult. It can affect only 1 to 2% of children, and also the symptoms sometimes severities can also be high in childhood, where we have to interfere with the systemic immunosuppressant. Okay, otherwise we can manage with most of the cases mild to moderate. We can manage with the topical or phototherapy.
Okay, so these are the various treatment options which are available of psoriasis. Doctor, as you have mentioned that seasonal, sometimes psoriasis can also be triggered by seasonal. So is it like that? Can the sun help or it triggers the psoriasis?
So that's a debate. So like sun exposure itself, as we know, the psoriasis tend to improve in the summer season. Okay, some milder exposure can be beneficial, but severe like very high radiation or sun exposure can induce actually or trigger it, because most of the UV rays are type A, which is going to induce. What we need is type E. That is what UVB going to improve. Even UVA in a smaller dosage can also improve, but it's a debate. Some patient can have a triggers, and some patient can have a improvement. That's
Okay, so it depends from people to person to
most of
person.
the time we avoid too much. See, some there is psoriasis therapy, POA therapy, where sun exposure can be given, but in specific time and specific time period. Over what we take home message is over exposure of sun exposure is not good. Okay, and only doctor can tell you how much of minutes you can apply and what are the medicines you use, then expose yourself to sun, which to have a better uh, therapeutic application of the sun exposure with the psoralen. There are certain group of drugs psoralens, we use it with the sun exposure also for the treatment option purpose.
Okay, so it depends from person to person. And doctor, if somebody is on medication in psoriasis, how long the treatment goes?
So generally it will take longer time. So if it is depends on the severity of the disease what you're going through, generally it will take 1 or 2 months for complete resolution, and depends on the response of the patient also. We can slowly withdraw the drug and put the patient on only on the maintenance therapy like emollients and mild steroids.
Okay, and doctor, what is psoriatic arthritis?
So psoriatic arthritis, just like psoriasis involving your skin, it can affect your nail and joints and any part of the body, right? And psoriatic arthritis is most common in not like in most of 100% of psoriasis, only 40% of patient can go have a psoriatic arthritis. The most common involvement is the your smaller joint, distal phalangeal joints. Then comes to the one single joint, or it can be multiple joint. There are different types of psoriatic arthritis also. So patient can have a deformities of the fingers because of erosion, osteolytic lesions, all these things. They have deformities of the fingers, all those things, difficulty in walking, pain, swelling of the joints. All these are the common symptoms of the psoriatic arthritis. So psoriatic arthritis can also be well managed with immunosuppressant like methotrexate.
Okay, so that means it can also be treated. And what are the early symptoms of psoriatic arthritis, if you can mention, so that people, if they are having it, so the early symptoms, so they can identify that this is something happening to me.
The most common symptoms are painful joints, that is, then swelling of the joints. Then, in the later stage, they go for deformities, flexural deformities, unable to extend the joints at the small fingers, and swelling of the joints, back pain. The psoriasis can also have a sacroiliitis, so back pain, severe back pain. All these are the symptoms they can experience.
Okay. And doctor, what are the organs usually which are affected by psoriasis?
Psoriasis directly will not involve any organ, but comorbidities itself can predispose the involvement. As I already mentioned, it can have arthritis joint involvement, and it can have metabolic syndromes, that is predisposing the patient for obesity. Then is vice versa. Okay. Then diabetes mellitus, hypertension, cardiovascular disorders. These are all the systems can be involved, or it put it in a word like associated with psoriasis.
Okay. So these are, as you say, that the organs may not be directly affected. What are the ma'am, areas, that are highly affected by psoriasis?
As I already mentioned, most common is chronic plaque psoriasis. This affects mostly on the extensor surface of your body, mostly on the extensors of their arms, then elbows, back, and legs, knees, lower legs, palms and soles. That is called palmoplantar psoriasis. Sometimes nail psoriasis, only nail involvement. It can cause pittings, nail deformities. On the scalp involvement, only patient present with thick scaly plaques, which is very annoying to comb, and sometimes itching can also be features of the scalp psoriasis. Then you can have the palmoplantar psoriasis and flexural psoriasis. All these are the types of psoriasis. It can different. Some patients come with only flexural involvement of the lesion, that is called flexural psoriasis. So on the detailed examination only we can find out what type of psoriasis it is. Mostly it is extensor surface of the body, skin surface.
Okay, so mostly it will affect only the skin surface, not the organs, as you have already told us that it cannot highly affect the organs, but the skin. And if it is not treated, then what happens? Sometimes people also ignore that this is something happening, let it be. So if it not treated well, what is the worst case scenario?
See, it depends on what type. Is a mild, moderate, severe. If severe patients like psoriatic involved all over the body, if you're not treating, patients is tending to lose lot of protein in the form of scales. They're just losing. They may become hypoproteinemia can subside, and patient go for erythroderma, as I mentioned, whole body involvement. It is just a emergency conditions like where there's a fluid loss is there, protein loss is there, electrolyte imbalance is there, which can also affect, and patients can be exposed to a lot of bacteria, so patient can go into sepsis. That become a dreaded complication, so if you're not treated in a right time and right in a proper way. Okay. And mild cases, they get away with the just topical over the counter application under medical treatment to avoid the complications. And as such, psoriasis is a chronic disorders, it will make you prone for, or it can diabetes. All this can exaggerate the psoriasis lesions, and we have seen many patients with cardiovascular disorders also. So better to get treated and evaluated by the dermatologist.
Okay. And doctor, I'm sure that you might have come across a lot of people who don't go to dermatologists, and they just treat it by over-the-counter products or self-medications or home remedies. What advice you would like to give to all the people? Because people think that, going to a dermatologist is a big thing, and why not treat psoriasis by their own? So what advice you would like to give to all the viewers who are watching this live?
My advice is kindly consult your dermatologist. He knows you best. He knows the disease best. The doctor knows the best treatment for you. And unless you make them complicated by applying your home medication, all this, just visit them and take a right advice. What are the precautions? What are the lifestyle modification you have to do? What are the drugs option available for you, particularly for each patient? So you should better. My advice is to consult a doctor.
Right, definitely. And doctor, we also have our live viewers who are watching this live. Some questions of
Okay.
them as well. There is Rohit asking, are there alternative therapies for psoriasis?
Alternative therapy in this also, I have already mentioned topicals are there, creams are there, phototherapy is there, tablets are there, immunosuppressant. These are all the medication and barrier skin to improve the skin barrier. We have ceramide based moisturizers and all this they can help you.
Okay. And there's another question that how does psoriasis differ from eczema?
So psoriasis is a chronic disorder. As such, eczema itself is a chronic disorder. So as eczema, clinically we can differentiate. Eczema is more oozing lesions and it causes a lot of itching. And yeah, it spreads. The typical area of involvement can also be same place. It also present on the hands, foot, all the things. But eczema has a triggering factors like your um, allergens like detergents, soaps, all these can trigger the eczema and it is more oozing. It becomes very wetty when you scratch and infected. But psoriasis is always not a oozy lesion, the thick blocks and scaly patches. Okay. That's why when it's better to take a dermatologist opinion for differentiation. And the initial stage, the treatment remains the same for both, but in chronic stage, we have to differentiate the stages of eczema and treat it.
Okay. And doctor, as you have mentioned, that in eczema, it is also like that some products are not used on the body. Is it like that in psoriasis as well? Some kind of soap or some kind of cream is not advisable to use.
In psoriasis, we advise what to use, and some they don't trigger as a topical, other than the topical application of steroids, sudden withdrawal of the steroids, all this can trigger. But as such, soaps and all those things going to affect the psoriatic lesion, not going to improve or worse. And rarely it can worsen if you're using the very high alkaline medications like detergents or the handling with that, especially in palmar psoriasis, all this can little irritate the skin and exaggerate the lesion, definitely.
Okay, we have discussed about the symptoms, the treatment. Viewers have also asked some questions. What are the myths you would like to clear about psoriasis? That these are the
Yeah.
myths
The
going around
main
the
myth,
world, and
yeah. The main myth I would like to clear about psoriasis is it is not contagious. So don't discriminate the patients and don't make them feel socially withdrawn or anything. Just support them. And as psoriasis is completely curable disease with the right medication, so you need to educate your family members or your friends that no need to get socially withdrawn or yeah, all those things can be explained to them. And right treatment, it is completely curable disease, but it's a chronic. And yeah, sometimes it triggers a recurrence will be there, but waxing and waning we call it, but it's completely curable.
so it is curable. Don't treat your friends or family who have psoriasis different from you, as Dr. Anupama M Prasad have already told us that it is not contagious. It is a curable disease. Doctor, before we end this very informative live session, any advice and takeaway message you would like to give to all our viewers watching this live?
So, advice for the psoriatic patient is to get examined yourself by a qualified dermatologist and get treated at the right time and follow the medication and advice given by the doctor rightly, so that you don't end up in having the steroid thing, and don't pop in all the oral steroids, which is not a treatment option for the psoriasis. So oral steroids is not an option, so it's going to exaggerate. So please consult your dermatologist to give you the right treatment, so it can be have a better quality of life with the psoriasis.
Okay, so now that's the message to all the viewers from Dr. Anupama. And thank you so much, Dr. Anupama M P, for your valuable time. And it has been a very informative session for all our viewers. And we really look forward for many more such sessions in the coming time as well, Doctor.
Thank you so much for having me here. I had a good interactive session. Thank you.
And it is really great to hear you. And thank you so much for clearing all our doubts about psoriasis, about the symptoms, the cause. We have talked about everything. Thank you. Thank you so much. And
Thank you
thank you
so
so
much.
much. Thank you, doctor. And thank you so much to all our viewers for your participations in today's session. To get latest update on how to keep your skin healthy and to like and follow our Facebook page that is all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you so much and good day to you all.